everyone. Let me welcome you on the strike of 5 p.m. in Cambridge to the study of the Master of Trinity College. Colleagues, friends, collaborators, welcome to the launch of the Trinity Challenge. I'm joined this evening by 4 colleagues who lead their contribution to the Trinity Challenge, and I'll introduce them in a moment, but they're part of our founding membership for this unique challenge. Let me give you a bit of background about why we're here, what we hope to achieve, and why we want everyone to join in. So it starts really with my background. I'm a doctor, and I looked after patients with sickle cell disease, an inherited blood condition. And as I progressed my career, I developed a passion for research, public policy, and systems leadership. And many of you will know me for having set up the National Institute for Health Research in the UK. And then for nearly 10 years, I was the Chief Medical Officer for the UK and the Chief Advisor on all things health to the Prime Minister of the UK. I want to put on record my thanks to Professor Chris Whitty, my successor, for his effort and leadership throughout this crisis. But now I'm here in Trinity, following in the footsteps of Amartya Sen, Lord Martin Rees, Sir Greg Winter, and I've been watching, along with all of you, the devastating impact of COVID-19 as it unfolds. So today we, myself, Kevin, Manoush, Jodie and Adrian, who I'll introduce, along with other founding members, are launching this Trinity Challenge. It's unique because it brings together partners from university, private and the social sector to use data and advanced analytics to learn lessons and develop insights now so we can do better next time in the next pandemic. Because after all, COVID-19's brought our world to its knees and we were simply not prepared, as the Director General of the WHO said. We can and we must do better to make sure this never happens again. And we can and must ensure that more people everywhere across the globe, poor and rich, are protected from the devastating impacts of health emergencies. That, of course, presents us with an opportunity to come together, to learn, share, collaborate, an opportunity to better use data and analytics to strengthen and improve global public health. And here we are with the challenge, an opportunity to identify and reward our very best thinking, such that we're able to better identify, respond, and recover from health emergencies, such as COVID-19. So you've picked up, we're focused on 3 areas. Identification. And what we mean by this, as an example, is what if we had an early warning system that could identify pathogens before they caused great harm? We're focused on response. What if we knew what targeted intervention was most effective in response, and how could we ensure that it's adopted at minimal cost? And then recovery. What if we knew how to initiate a social and economic recovery in a way that didn't exacerbate inequalities? This initiative, the Trinity Challenge, is designed to support and strengthen the agenda of the WHO to protect more than 1 billion people from health emergencies. And the Director General of the WHO, Tedros Ghebreyesus, has endorsed our efforts. We seek also to support and advance some of the work of the Global Pandemic Monitoring Board, the GPMB, whose report, the first one, was released this morning. So how are we doing this? Well, we're doing 3 things. First, launching a public challenge to generate, identify and recognise boundary-spanning insights across the categories of identification, response and recovery, as I said. Indeed, we're setting a series of urgent questions to harness the potential of data and analytics to learn and share lessons from the great innovations made to combat COVID-19 and build resilience against future emergencies. A reward pool of more than £10 million will be made available to the challenge teams to reward, support, scale their innovations across areas including economics, behavioural sciences and epidemiology, as well as the infodemic, and we'll come back to that. Second, convening high-impact collaborations from diverse sectors and geographies everywhere across the world to drive action immediately, actually now. And then third, we're setting out to strengthen the data and analytics ecosystem in global public health and committing to trusted data collaboration by promoting openness, privacy, security, empowerment, and usability. So now I invite my panelists to join me, and I introduce to you Baroness, it's so new, Minouche, sorry, Baroness Minouche Shafiq, who is the director of the LSE. And I'm going to start with you and ask you the questions I'm going to ask each panelist. What excites you most about the Trinity Challenge, and what's your organisation going to do to contribute?
Well, I think that the challenge we face of securing a recovery from this pandemic, and more importantly, preventing another one, are incredibly complex and require collaboration across sectors, countries, disciplinary boundaries. And I think it's fair to say that one of the problems with the response to this pandemic is that collaboration was not great, particularly in terms of our political leadership. I think scientists have done a slightly better job of pooling expertise, sharing risks, and investing together. But the response would have been far more powerful if we had much more collaboration, particularly across countries. And what the Trinity Challenge does is provide a framework and a platform for doing that, for bringing together complementary skills, resources, and data to find solutions. I think for the LSE, what's really exciting is that we can bring to the table our expertise across the social sciences with the enormous technical expertise, global reach, and access to data some of the other partners in the Trinity Challenge bring. Just to give an example, we need behavioral psychologists, of which we have many excellent ones at the LSE, to understand how best to develop and implement solutions in ways that counter misinformation, encourage public compliance. Until we have a vaccine, the most powerful weapon we have for this pandemic is public communication. But unless we have consent and social solidarity, it won't work. We need economists to understand how to mitigate the impacts of the pandemic on growth, development, jobs, and deal with the inequalities that we're seeing everywhere. We need sociologists and anthropologists to understand the impact of the pandemic on our societies, on public health, on families and communities. We need expertise in law and regulatory matters to design legal frameworks that balance public access to data with individual privacy. And we need expertise in public opinion to understand trust in public health policy decisions, such as lockdowns and vaccine approvals. And so I believe that working together through the Trinity Challenge, we can bring that expertise to help collectively find solutions together. And I'm very much hoping that we can do our bit to contribute.
Thank you, Minouche. So you are representing the academic sector here, and we also have as academic partners Cambridge, Northeastern University, Hong Kong University, Imperial, a number of them. Let me now invite Adrian Gore, who is the Chief Executive of Discovery, to join us here. I hope the IT is going to work, but Adrian.
Sally, thank you for that, and we are very proud to be associated with this exciting challenge. I think, as has been said, I think the power of collaboration, and I think the power and the scale of what's being brought together here is so remarkable. So the ability to make a real difference in something so important as this, I think, is really, really important. We are proud to play a role in it. Our organization, Discovery, with Vitality, is a global life and health insurer, and for over 2 decades, we have used incentives to get people to change behavior, focus on wellness and prevention, focus on physical activity, and we've priced that into life and health insurance and have over 45 million life years of data around correlating those behaviors to the effect on sickness and on mortality. It's interesting that our model was first conceived around the idea of non-communicable disease, the well-known statistics around the correlations between just a few behavior types and death and disease burden in the NCD space. But what's remarkable about the COVID pandemic and from our data is just the same kind of factor. So particularly physical activity has such a dramatic correlation on retarding the potential risks of COVID and probably other infectious diseases. I mean, our statistics show that a 65-year-old is probably 60% more likely to die from COVID than a 45-year-old. But just a bit of exercise a week brings that risk below that of a standard 45-year-old. So the effects are dramatic. So our intention, our hope is that we can share our data. We have an organization that brings together actuarial science, behavioral science, data science with a considerable capability, and we'd like to inject that into this powerful initiative. So we are excited to be part of it, proud to be part of it, and I hope we can add considerable value. And we're grateful to you for having brought this together. Thank you.
Thank you, Adrian. I think you're going to play a great part in this, and I'm particularly interested in this physical activity data, having been Chief Medical Officer. Indeed, I'm going this evening to get on my exercise bike because of it. But what I also think is great is that because of this collaboration, you're going to work with the Bill and Melinda Gates Foundation and have a look and see if what you found in South Africa holds true for other health populations, because if it does, then we have even more reason to be active across the world. So bringing these things together, as you've already started to do under the Trinity Challenge umbrella, is absolutely great. Thank you. So now I invite Jody Ginsberg to join us on the screen. I must say it looks rather nice in South Africa at the moment. I'm hoping that Mustafa will give us Jody.
Hi, Sally.
Hi, Jody. So let me explain who you are. Well, you can do it. Chief Executive of Internews. Tell us what Internews is, because I was so thrilled when you said you'd join us. And then talk to us about the excitement you bring to the Trinity Challenge and what you're going to do.
So Internews is a global non-profit. We work in over 100 countries across the world, mainly in media and information development. So we understand how important accurate, trustworthy information is when dealing with a pandemic like COVID. And I think what's amazing to us about the Trinity Challenge is it's just an incredible opportunity to rethink what we understand, all of us, by expertise. We know from all of our work that experts don't just come from big global organizations. They don't just come from well-funded Western academic institutions. Sometimes the most useful, most important insights come from local people and local communities. And what we want to do, and why we were so excited to be part of this challenge, is to make sure that those experts aren't just heard, but that they have an equal seat at the table. And so I think the challenge gives them an incredible opportunity to participate in the solutions that we are seeking to prevent future COVID. And they can network and generate ideas with amazing and stellar partners that have the kind of reach that the likes of Discovery and LSE and others have. So that's what we're excited for this challenge. And I think what we can bring is a really deep understanding of the role that information plays in healthcare in particular. And you heard from Manoush, we can have all the brilliant vaccines in the world, but unless people know that they're safe to use and how to access them, then all of that investment is effectively for nothing. We ran something called a rapid response fund during the first months of the crisis to help support media and information providers. And it was striking how many of the requests were for people looking to translate information into local languages. So often governments would translate World Health Organization information into the main language of a country, but fail to do so in local dialects or regional languages. And so perhaps understanding in advance, for example, if we're seeking to prevent a future crisis, that you need to have information translated into dozens of languages and dozens of formats in advance, means that you could avoid some of the delays that have helped create such a widespread pandemic.
Thank you, Jody. You can see why we were so excited that Jody brought Internews on. And I think you'll help us make sure we're grounded and that we reach out to real people, as well as geeks and nerds. I love geeks and nerds.
I love geeks and nerds too.
You have to if you live in Trinity, I can tell you that. Right, the final panelist joins us. I've just discovered I can see everyone on my laptop. I don't know whether others can, but it does mean we have to look nice all the time. The final panelist is Kevin Sneeder. He's the global managing partner of McKinsey. So please, Mustafa, bring him on. Great.
Thanks, Sally. It's good to see you. And thanks for the chance just to share a few thoughts. I can't help but think that, like many of you, I think most of us were asked at some point in 2015, how did we see ourselves 5 years from then? And I don't think any of us would have answered in the middle of this pandemic, facing this challenge at this time 5 years later. And I certainly hope that we will be better placed to answer that question for 5 years from now. And in a way, I see the Trinity Challenge as really a major effort that allows us to address what is a very complex challenge, because on the one hand, we must save lives, but we also must save livelihoods. And saving livelihoods actually does hinge on the extent to which we can tackle the health crisis that we are now facing. And the Trinity Challenge, with its efforts to identify, respond and resolve, to me represents an innovative and indeed compelling way to set about the task at hand. And we certainly have more than our fair share, perhaps, of geeks and nerds, but we also, I hope, bring at McKinsey a sense of how this plays in terms of the interconnectedness between the world of solving the problems on the health side and what it means for the business community. And with that comes a set of data, both epidemiological and economic, that I hope we can put in service of this effort. A set of tools, practical tools that we've used with government, business leaders, healthcare providers and others, small and medium enterprises, to really bring a practical sense of how to tackle the crisis that we face. And also research and insight. Right at the beginning of this pandemic, the McKinsey Global Institute started to look at what is it going to take to crush this virus, both from an economic viewpoint and indeed from other viewpoints too. So I hope we'll be able to bring those capabilities to the task at hand, and to do so in a way that really I think is going to be vital. A multicultural effort, an effort that spans all parts of the globe, that really doesn't let itself get caught up in the political debate, a very valid debate, but not one for this challenge, and which at the same time really brings to bear the power of very different approaches, just as we've heard from Internews, Discovery, the LSE, and hopefully ourselves.
Thank you, Kevin. Of course, saving lives is about so many different things. It's not just saving them from COVID. We've got to save our routine health systems, the vaccinations, the preventive, let alone the screening for cancer and treating for cancer. And that is something that not many places have got right yet. And then there's the economy, isn't there? So, let's put you all in a fishbowl. Can we see you all together on the screen? Mustafa, will you make that one work? It'll be interesting. Because I actually think that we should have a bit of a conversation about the issues at hand and what you think the strength of bringing some of this deep data from the big companies is together. I mean, Kevin, you know, this is a dream when you get Google, Microsoft, Tencent, Discovery, Legal and General, Swiss Re with this big data store saying, yes, we do allow you under privileged access, so the privacy of that data, it's depersonalized anyway, it's protected. Don't you think this is a unique moment?
This has been a unique moment. And I do believe it's a unique moment. Let me be clear, because I think what's unique about it is we have seen cooperation and collaboration across divides really make progress. Many of the advances we've seen both in the clinical practices and indeed also in the vaccine development hinge on people working together in ways that we've not worked together before. What I think is particularly unique is to bring together to this task the public sector, the private sector, the social sector, the academic sector. Think about that collection, then being able to leverage the data and the insights of the group that you just referenced. That's unique. And we've got to make the most of it by also being unique in the way in which we then tackle and solve the problem. This is not going to be the kind of situation that gets addressed through a linear programming effort where out pops the answer. This is going to require a lot of diverse perspectives coming together in a really creative way. And that's why I think the challenge is the right way to go about this.
So, Minouche, you and I know and love academics, and they live by the grants, they live by the peer-reviewed papers. What do you think are going to be the barriers for the academics to get them to join in? Because they will ask some really good questions and bring some great brains into this. Can we have...
Since the crisis, we've actually had a program that my colleague Simon Hicks at the LSE has been running on getting academics engaged on COVID. And we put forward a tiny pot of money, peanuts compared to what you're doing in the Trinity Challenge, and said, who wants to do some rapid research on COVID? And we were deluged. We had hundreds of people coming forward. So I actually think the appetite is huge. Everyone is affected by this. What's been really interesting is the breadth of disciplines which have come forward. The economists you would expect in terms of thinking about the effects on unemployment in the labor market, but also the geographers and how COVID is changing place, where we work, where we live. The anthropologists have played a vital role. The bubble policy that's allowed people to be with small groups of people, that was designed by the anthropologists at the LSE. And so you see that you can bring in all sorts of people with all sorts of skills and come up with much more creative solutions. So I think mobilizing them, this is something that's affected all of our lives. I think mobilizing people to contribute will be the least of our problems.
Good. That was what I thought, but it's great to hear. How do you think, Jodie, we're going to get in more of civil society? What else do we need to do? Because we're doing it for all of us, and that's civil society.
I think we need to, first of all, challenge ourselves to check that we are asking the right people, asking the right questions. I often think in these challenges, it's very easy to charge off down a path. Here's a problem. We need to get vaccinations right. Let's charge off down a path. Or we need to get, test and trace right. And then everyone forgets to think about privacy and privacy implications. So I think one of the things that we can usefully do, and this is why this is such an interesting group, is challenge one another to make sure that when we're charging off, for example, enthusiastically talking about data and pots of data, that we have the privacy right and we've thought hard about how we're going to use people's information. And I think actively going out and seeking unusual sources of expertise, looking at the places, for example, around the world that have had low incidence of COVID and why, because they're not all in the places that you think that they might be, and trying to understand that, I think, will be key. So I think challenging ourselves to think outside the box is the way that we are going to draw in those different thinkers from civil society.
Absolutely, yes. So it's interesting that when we started debating this idea and I started talking to people, I had this idea of the challenge and that we'd need a big pot of money and people would compete for it. And do you know, that idea was got rid of by all of you and many others who said, no, this has to be a collaborative that comes together because we all want to make a difference. And so, yes, some prize money, but actually that's about recognition to help global public goods move on and be taken up and scaled rather than about making someone rich. And I have found this journey with people of collaboration, when you think about all the people who are involved, just amazing. So let me give you, who aren't on the call because our founder members know it anyway, just a little bit more colour and detail about why we're so very, very excited about this unique coalition of some of the best brains in the world. The founding members. Well, you've seen some of them here. Let me go through. Aviva, Bill and Melinda Gates Foundation, the Brunswick Group, the University of Cambridge, Discovery here, Facebook, the Global Virome Project, Google, Hong Kong University Medical School, Imperial College London, the Institute for Health Metrics and Evaluation in Washington, Seattle, Internews, you've seen, Legal and General, LSE, here with Minouche, McKinsey, we've got Kevin, Microsoft, Northeastern University, Optum, Reckitt Benckiser, Tencent, and Zenith Technology, and GSK. It's absolutely snowballing. These founding members contribute to the challenge in a variety of ways, including, but not limited to, working together to bring their own submissions to the challenge categories, identifying and maximizing synergies between submissions across the challenge categories. Remember, this isn't about making anyone rich, it's about saving the world, after all. Contributing their founder member support to the challenge broadly across their networks, participating in the challenge events, providing access to their own data while in full compliance with all relevant permissions, and I'll come back to that. Supporting challenge teams with resources, technology, infrastructure, research space, and access to subject matter experts, and making financial or commercial contributions. This is a truly global effort, so I'm delighted to tell you more members are already signing up. I've mentioned Swiss Re, but there's also Fiocruz Institute, Joop Langer Institute, and Tsinghua University, and I'm sure we're going to see more people. Perhaps if I pick up, because Jodie brought it up, and it's here in my notes to make sure I don't forget it, about data. Privacy does matter to all of us, and there are different ways of delivering it. So there's open data, and we discovered lots of academics don't know what open data is there. So when you log in to our website, you will find a data catalog with the open data that is there. But also, all of these founding members are offering access to their other data under privileged access. That means under their governance rules and the governance of the country they're in. So a proper legal document will be signed between the team and that company, and the insights can be made public, but of course the data will stay where it is. Privacy is very important. We're looking at other ways. Microsoft have got clever statistical ways, and other people have ideas, but we insist we must make sure this is properly done. So let's have you all back on screen again and think through a bit about what you think the big challenges are that you think might be answered and how that might be done. Jodie, we're starting with you.
So I think the big, for us, obviously, as a organization that thinks deeply about information and cares deeply about information, the response part for us is the big challenge. How do you successfully communicate information to large populations, but in a nuanced way? In other words, how do you make sure that the information you're providing is being provided in the right way, the right languages, people are able to access it in many different ways? That's we keep talking about complicated and complex. That's a highly complex challenge. It's not just about getting one message right and hoping that sticks. If you want a good example, often we've seen governments during this pandemic pick mainstream media organizations, for example, to communicate health messages. Well, that's great if you read a daily newspaper or you watch the BBC or ITV, but if you rely on community media or you don't speak the national language, then you're not getting access to that information. So thinking really intently about how we respond to those nuanced information challenges, I think for me is the big thing I would like to see responses to.
And do you want to mention that you're already in a collaboration with, surprising to many outsiders, Facebook?
Yes, and I am on record and would always be the first person to be highly critical of Facebook, but we're working on an interesting collaboration where we're looking at working with Facebook on identifying trusted partners in a number of countries such as Colombia and Afghanistan, to work out how best we can provide that trustworthy and accurate information in a way that is relevant to certain local communities. And that's based on our experience of Zimbabwe, for example, where we actually saw in a randomized control trial how people's behaviors changed positively when they were presented with accurate and trustworthy information targeted through social media messaging and platforms like WhatsApp. So seeing how that can be scaled up, I think, will be really interesting.
It will, won't it? And maybe help them with some of their other health messaging with the WHO. So, Kevin, you've been working with us on these, from McKinsey's, on these challenge questions. What do you hope we can see answered?
Well, if I pick one for each of the three areas, Sarah, that you highlighted, I think in identification, if there is a way that we can advance being able to switch to always-on disease surveillance systems, or a way to actually really track live what is going on so we can break the transmission chains, that would be, I think, hugely impactful. On the response, if we can make a contribution towards collaborating across sectors and globally to improve the global health response, I mean, I think that could be one of the outcomes here. And thirdly, one of the big issues to be addressed is how to gather data when it comes to recovery for vulnerable communities to enable this to be a more inclusive recovery, because absent intervention, it won't be. It's going to be less inclusive. These are the kind of things where I hope this challenge can really help make progress against some pretty fundamental issues.
Yes, thank you. Since the beginning, we've had a focus that we must learn for the vulnerable as well as everyone. Yeah, thank you. Minouche, how about you? What are the answers you hope, or challenges you hope we'll get out of this?
For me, I am quite focused on prevention. We all know that cliche about an ounce of prevention is worth a pound of cure. I think COVID has shown us that an ounce of prevention is worth infinite cure. I mean, the return on prevention, given the huge devastation this has caused to the world, is so large. I spent most of my career working in international development, and decades of progress in poverty reduction is being wiped out in the last 6 months. The cost is just unbelievable. And so for me, thinking about how to prevent future pandemics having these huge consequences is really key. I also spent a lot of my career in being a central banker and being at the IMF. And we spent most of our time trying to prevent bad things from happening, from financial crises, bank failures, country failures. And this crisis has shown us that our health systems were too fragile, our buffers were too thin, the stock of capital we had in the bank was too little, and the risks of spread were just too high. And so getting to a world where we prevent this kind of thing happening again as much as possible, and then when it does happen, preventing the spread, for me, is the most important. I mean, we've had 4 pandemics recently. We've had SARS, MERS, Ebola, and COVID. The first 3 were devastating, but they were geographically contained. They didn't bring the whole world to its knees. And I think understanding a bit better that prevention and containment strategies to prevent this horrible thing from ever happening again, for me, is the biggest priority.
Yes, and I've had people from other parts of the world say, we thought that the toolkit, the rule book, was what you would have in the north, and we'd just follow it. You need to learn our rule book. So there is a lot of learning to be done across the world, north, south, 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 and east to west as well, isn't there? Which I think is going to be very, very important as we go forward. Adrian, how about you? We're talking about the big challenges and which you'd like to see answered.
Well, I think there's some inevitability of these kind of health emergencies. I guess our interest is resilience. In other words, when they do happen, how resilient are people? And again, in our lane around behavior, can we really understand the correlations between certain behavior types and resilience? So one of the things we're already doing as part of the challenge is collaborating around a resilience index, correlating age, gender, pre-existing conditions, and understanding the effect of physical activity and other things on resilience to COVID. And our hope is that kind of understanding will give us deep insight into making people resilient when it does happen, limiting mortality rates, limiting morbidity rates. And amazingly, I mean, with some change to behavior, we've seen that you can make mortality rates dramatically lower. So our initial focus will be on behavior. That is what we do, trying to understand incentives to change behavior. But hopefully our data and collaboration leads to other things. So this is it's a tragic time, but a profound time, and we have great expectations.
Thank you. Yes, well, I'm hoping we can learn all of this and more. And of course, many of you will know I have a passion for sorting out antimicrobial resistance. And I'm as I said a bit earlier about the lobster slowly boiling, I'm hoping that some of these lessons will help us work through how to make sure that we don't lose modern medicine to the fact that we don't have enough new antibiotics and we're not looking after the ones we've got. So here I am asking you for all sorts of questions. I'm told I should put myself in the hot seat and let you ask me questions. This is where I'm not prepared. So can I answer anything for you? Because we don't meet that often. Please, Adrian.
I'll ask you a simple one, Sally. You've had an amazing vision here, and my deepest respect to you for pulling this all together. But what would winning be? I mean, what would give you a sense of great, 6 months a year on, what would be a real home run for this initiative?
Well, I hope we will have some really good insights. I actually do believe we will. To do that, some of the looks and hunts will fail. Not everything will succeed. We've got to take risks academically in our exploration of the data and understanding. And I hope we will then have, wouldn't it be wonderful if we had always on surveillance, if we knew how to get messages across and understood why people don't want to wear face masks? Wouldn't it be wonderful if we began to get inklings in this first round of how the economy could be helped to recover by doing more nuanced lockdowns or protection of bits of our community? I think the other thing, in addition to the analysis, is can we build this so that there is trust between all the partners, founding and new members and the challenge teams, and with the public, so they recognise that this is done to the highest principles for the global good. And I think that comes back to behaviours, but I think it comes back to the data, to how we handle it, the data governance and stewardship, as we've been talking about. And so I think we need not only to answer the questions, but to think very carefully how we answer them. But success will be a very multi-layered thing. And you must remember that we're going to run this cycle of public challenge for 3 years. So I'm hoping we'll have 45 really great ideas at the end of 3 years. How about that?
That's great.
Sally, can I ask you a question?
Please.
So quite deliberately, this group is a group of independent organisations, not government organisations, but the key actors for good and ill often in this pandemic have been governments. And I wonder how you see the challenge or the participants engaging governments so that we can make sure that whatever is come up with during this challenge actually has traction and can be implemented.
I think that's a really difficult question. There are two bits to this question. The first is that I believe going forwards to work effectively in doing better next time, or even this time as it goes on, we need networks of trust. And we can build those across academia, and I believe that we can build them across this collaboration, the Trinity Challenge collaboration, and that will help everyone across the world. But of course, governments are not only policy making, they're delivery agents. So it's terribly important that our findings are disseminated to them and made relevant for them. And we're going to have to look at how we hand them off. The World Health Organization is a key part of that. The Director General, you'll see from the website, is, well, as a founding member, is very supportive of this. And we're going to ask one of them to judge so that they get early sight of what the insights and answers are coming out of this process. But we're going to have to work with all the delivery agents, not only the WHO, but Global Fund, Gavi, and others, to make sure that they know what the insights are and how they could make things better based on what we've done.
Sally, could I throw a question in? One of the one of the problems with the response to this pandemic is that we have seen a very nationalistic, narrow approach to what is so clearly a global problem. But how do you see us being able to kind of remind people that the idea that you can solve this in your own national borders is both misguided, but also a lot more expensive than trying to solve it at a global level? How can we use the data, the analysis, and the network to be able to demonstrate that?
Oof. I'm hoping you're going to advise me as we go, Minouche, with all your fantastic experience and background. But we do want people from the whole world to join in, and we are reaching out. Discussions in Africa, India, Latin America, and everywhere, because this is the key thing. No one can do it on their own, no person, no organization, no country. We need to come together. And I think that openness, looking out and call and support is very important. I start next week on the fundraising for rounds 2 and 3. And if we could raise enough, I'd dearly love us to have a student category where students from low and middle income countries in particular could join in, but perhaps elsewhere. We've got to make it easy for people to join in. We've got to make it easy for people to hear what we're doing and feel they too can be part of it. And we have to share. And I think that one of the few good things coming out of the pandemic is the increased use of Zoom, that we've all seen. I haven't done perfectly on this particular Zoom call, but hey, at my age, maybe I can't. And we should be able to reach out across the world much, much more easily. And I think we need to find innovative ways to do that so that people are with us rather than against us because they didn't know what we were doing. But that's going to be work in progress. And any advice from any of you is very welcome. Of course, many of our participants are multi-country, but that isn't the same as having people from those countries really joining in themselves.
I guess, Sally, one last question for me would be, and I think the Zoom call's gone very well, we haven't had a you're on mute moment, which sort of means it's been a success. But if you think about the complexity of this challenge, because the context is so different in different parts of the world, you already talked about the need to take into account vulnerable communities. How do you think that's going to work in practical terms? Because we do have, the strength of this is indeed the diversity of people from many different places. But on the other hand, the nature of the challenge is one that addresses so many different contexts, so many different realities, hinges on data. I'd just love to understand how you see that working, how you think we can work across those divides.
Well, I've always thought that when you face a complex problem, you can either put your head in a hole, or you can say, which bits can I attack now? And I think some of the very interesting work will be looking in this mosaic or jigsaw at how different countries have done things, how different people from different cultures have responded, and learning from each other and from the data in different countries. Because there's no doubt that people have had different responses. How have they worked? And then you go back to the behavioral thing. If that is a response that works, what are the behavioral issues and cultural issues that mean you could export it or share it elsewhere or modify it for somewhere else? So I think we're going to have to look at it bit by bit and put together this giant jigsaw. And I don't think it's going to be there in 2 or 3 years, but we can make a good start on it. And one of the strengths, but the complexities of this challenge is we've put these 3 big areas, identify, respond, and recover, and then we've given some illustrative questions. But actually, if someone in South Africa woke up and said, actually, the big question for me is the following, and I think I could get help from one of these companies and there to solve it, it might not be one of the questions we've written down, but it could be as important or more important to the solutions. So we're going to be open. And perhaps that's the moment to just talk a bit about the challenge itself as we come to the end. We're opening the challenge in October, and there's going to be more information on the website, the trinitychallenge.org. It's open to anyone from across the world who wants to contribute their thinking. An individual, a group of individuals can register, submit their ideas and insights. And as I said, I'm calling all geeks and nerds. And I think with Jodie, we're calling all real people too. So what will happen? The Trinity Challenge will call on people to submit impact-led ideas on how to safeguard our health and economic systems from the threat of global health emergencies. Submissions that make the selection will be supported with access to people, data and resources from founding and other members. So there may be no money unless you come out at the top of one of these, but there is help. And the idea being from that help to maximize the effectiveness of their solutions and leverage the world's leading expertise and innovation of these institutions. So those challenge teams will focus on potential solutions that support and strengthen the public health ecosystem across the globe in a robust, and we hope and we plan, an inclusive way. Solutions to be fielded globally through an open and accessible submission process will bring in the best minds and ideas. So what we're saying is you can come in and submit your idea and get help, but actually as well, at the finishing point, when those teams present their answers and their work, others can come in from the outside and say, I didn't bother with your process. Here's an answer, and this is what I've based it on. We want to be as open and inclusive as possible, with the idea of developing insights which will benefit the world, the whole world, in the future. It was our founding members who agreed on these challenge questions. They debated a number of factors and decided on these categories focused about how to generate, identify and recognize insights, particularly through data and analytics. But remember, data can be quantitative, but it can also be qualitative through surveys and other ways of finding information that's data rich. We've got the 3 challenge categories: identification, response and recovery, that were agreed by founding members as the most pertinent topics. And we think they can be inclusive of many ideas and solutions from everywhere across the world and target solutions, as I said, for the public good. We do think the data privacy matters, and we're beginning to talk about the need to move the conversation on about the value of data from being, the new oil into the value of the outcome that the data is. And I have been wondering whether we need a concept of data philanthropy developing and raising high up. If you're wondering how this particular effort relates to global health initiatives, you've heard from us today about how we support the WHO and how they see this as helping them. And we can reassure you that there is a fit across all of the public health architecture. Because we are working academia and industry, private sector, in a way that others are not, this collaboration and partnership. We've already seen a great collaboration between businesses, public health organizations, social sector and academia in taking collective action. And what we're trying to do is build on that momentum, not be in competition with existing initiatives, but actually trying to contribute to the future public health responses to global health emergencies and develop as a new supportive cog in this global public health architecture, convening and collaborating across these 3 sectors of private, academic, and social. So before I wind up, I wonder whether we could go back to all our colleagues together and ask you, if you have, and they don't know I'm going to ask this either, one message to people who've been listening to this who have not heard about it before, what is that one message? Kevin, you moved first.
I moved first, so that's dangerous. Get involved and send us your idea. I mean, there we are.
Yep, great. I think that's a good start. Yes, Adrian.
I like Kevin's start, but I think boldly. Put in some really bold ideas and challenges. Start with the end in mind.
Yes, isn't that good? Because what we're thinking about is impact. We want things that make a difference, that are scalable, not fancy theories, but really will make a difference to people around the world. Lovely. Minouche. You're silent.
Kevin, I gave you the you're on mute moment.
It's got to be one.
Yeah, good.
No, I think I kind of agree with Adrian and Kevin. I'd love to be surprised in terms of the kinds of solutions that come forward, and I'd love to be surprised at the solutions and where they come from.
So think laterally, think different. Yes.
This is a moment in history when we have an opportunity to do things differently. And, crises, the cliche about every crisis is an opportunity. Actually, not all crises are opportunities. Some crises go by and not much really changes, and you've just sown the seeds for the next crisis. Think World War I, think the 2008 financial crisis. Let's make this a crisis in which we actually change things fundamentally.
Thank you. I think we can, between us, with all the people out there, of course, it's not just us. Jodie, you get the last.
Well, I was just thinking that preventing the you're on mute moment might be the first challenge that we want to all overcome together. That feels like it would be a huge benefit to society. But more seriously, I would say back yourself. Experts come in all shapes and sizes and from all places. And if you think that you've got a good idea, why not try it? And you don't have to necessarily come from the traditional places that we might think of experts coming from to have a great idea, and it might be the thing that changes the world. So just do it.
Thank you. So I think people are going to get away a few minutes early, but thank you, Minouche, Adrian, Kevin and Jodie. And in closing, I want to highlight, we knew a global pandemic was coming, but we failed to prepare. We know there will be another COVID-19. So the only question we're left with is, almost as Minouche said it, whether we will learn the lessons of this pandemic or be doomed to repeat our mistakes again. The Trinity Challenge is a recognition by business and academia of the need for new breakthrough ideas and approaches to beat future pandemics and to work differently, to work together towards a common end for people across the world. I have to say that my own career has been inspired by making sure all people everywhere have the best life chances, and health is integral to that, and we're seeing this now much more than ever. So coming together to make sure this never happens again has to be the only thing to do, not just the right thing to do. We do need new ways of working, new partnerships, new ideas, and we believe that together this strong and growing coalition, as you heard, can and will generate acts that protect and improve lives and livelihoods everywhere. Please, everyone join in whatever way you can, because together we can make a difference. And thank you very much for joining us this evening in Cambridge, and I guess this evening in South Africa, because it was looking a beautiful twilight evening outside. And keep safe, all of you. Thank you.